I am Dr. Patricia Edward, consultant in obstetric and gynecology, working in Medcare Hospital, Sharjah. Today, my topic of discussion is abnormal uterine bleeding. Most of the people coming to the clinic present with this complaint, that is around 20 to 40% as a minimum. I am telling about it. I will talk about the normal menstrual cycle and why this abnormality is happening and what are the causes of the abnormal uterine bleeding, so that you will get a review of the topic but in a short time I can just review the causes. First, the normal cycle is, the menstrual cycle is usually from 24 to 38 days, and if it is less than 21, that is usually 20, that's a grace period like that. Less than 21 is abnormal, and if it is more than 38 days, it is also regarded as abnormal. And also the period date will be 2 to 7 days, it is regarded as a normal thing. And if the quantity, if we consider, we cannot tell, because before we are considered as above 80 ml is considered as the abnormal, but now we cannot tell that because it's a subjective thing like that. The pads we are using, the clots if we are passing, and you no need to consider that is 7 days, it's okay like that and see. But if it's 7 days, it is overflowing like that, that is number of pads we are using is more than that what you are using before, that also is not considered as a normal thing. But if it is okay, that is 5 days after that it is slowing down, and then you can consider it's a normal, and you can just keep a watch over it for at least 3 months and see how your menstrual period is going. Like this is the menstrual calendar usually we tell. And after that, this is the normal cycle, and this can be associated with one day, that is dysmenorrhea, that is pain can come. And regarding the abnormal uterine bleeding, we will just come to, before that we have to just tell about the causes. Causes are, it can be structural abnormalities of the reproductive tract, or it can be ovulatory disorders. The structural abnormality means it can be that it's a uterus, from the uterus only the bleeding is coming, and it is with the ovaries and uterus, and then the lower vagina, the thing is genital tract is vaginal or vulvar, that is local trauma. Uterine causes, it is like polyps, fibroids, adenomyosis, and depending on the age group, it varies. And another thing is the ovulatory disorders. Most of the people coming to us with the ovulatory disorders. The ovulatory disorders, before that thing, I will just talk about little about the ovulation and anovulation. Ovulation means there is two hormones like estrogen and progesterone are there. It is produced by the ovaries. And the other hormone that is from the brain, that is the pituitary gland, it is producing FSH and LH. These hormones are to be considered as the hormones which can go abnormal when our bleeding becomes abnormal, but doesn't be considered like abnormal. That is, every time the hormones need not be becoming abnormal for this. The ovulation can be happening, then also the bleeding can happen. Then I will go to the other thing, that what are the causes of the anovulation. Anovulation usually we consider as the polycystic ovarian syndrome. That also people are very worried about the polycystic ovarian syndrome. Always when we are having little bleeding, don't think that is a hormonal disorder, and no need to check all the hormone checks like that during the abnormal bleeding. It can be just like that, no, because the stress factor can be there, as emotional factors. Then it can be due to the pregnancy related, that is I'm coming to the causes. It can be pregnancy related causes can be there for the abnormal bleeding, or if you are using a contraception like that, it can be due to the contraception what you are using can cause the bleeding irregularity. Intrauterine contraceptive, that is loop what you are the local, that language like that loop, when you are using, you can have the bleeding, and all the causes are not due to the hormone thing. And regarding the ovulatory dysfunction, usually the polycystic ovary is the first most thing like that we have to consider. And another thing, I will just go on to the age group wise. This will be the easier thing for you to just, because now I'm not going elaborating the causes and it will be confusing. So the first is adolescent age group. Adolescent age group is the menarche. Usually now the children are getting the menarche earlier, and it is up from 9, it is considered as normal. 9 years, okay, from 9, it is usually 11 years is the age of menarche, and from 11 to 14 to 16 years, we can consider that adolescent age, that is maturity of the hypothalamic pituitary axis develop. There will be some irregularity in the bleeding. That is the most period anovulation happens. So that is considered as the anovulatory period. Then we comes to the anovulatory cycle. Usually it is that mid 40s. That is a perimenopausal, usually we call as that. Also the anovulatory disorder is most common in that period. Then comes the adolescent group, and usually the causes are anovulation, or it can be due to the bleeding disorder. What is most important is a history taking. And any cases coming within the adolescent, the history taking, that is a family history of any bleeding disorder. This is the most important thing. And how the bleeding I already told how the normal period and what is the abnormal thing. So another thing is this coming to the reproductive age group. Reproductive most common, any patient coming with the bleeding or any pain, we have to exclude the pregnancy first. And pregnant, and when if they are using the contraceptive pills, and the main thing, we have to change over the contraceptive pills, or we have to just stop that and see how the menstrual cycle is coming. Then pregnancy, that is a thing, you can have a home, at least one home pregnancy kit test before coming to a doctor like that, because whether to see whether it is a pregnancy related bleeding or not. Then comes, and in this age group only we are in the structural abnormalities. I will come again to the structural abnormality. The polyps we are seeing, fibroids, usually fibroids, or it's called myoma. These are the most common causes causing the bleeding. It can be the heavy menstrual bleeding, or it can be intermenstrual bleeding. These both are little different. Heavy menstrual bleeding means, I told you, up to 7 days is normal. If it is coming heavily like that to it is prolonging, that is the heavy menstrual bleeding. And usually it may not be any other pathology will be there. Usually it settles by its own, or otherwise we have the medical management is there. And other thing is the fibroids. If it is more than 3 cm, we can have medical management for a while, or we can have to go for the surgery if it is bigger, if it is having pressure symptoms, or if by medical management it is not controlled. Then comes if and I will go to the investigation part now, according to the age group like that. Adolescent age group, usually with the bleeding, first and most important thing is we have to do one full blood count to know the hemoglobin. And another thing is with the polycystic ovary syndrome, that is if she is having oligomeno, in between having bleeding, or if she is not having the bleeding for a long time, then this is typical of the polycystic, and it will be obese, hirsutism will be there. In these cases we have to go for the hormonal check. Otherwise no need for going for all the hormone checks for any bleeding like that. And the management part, I will go again for the thing. And first is medical management. Medical management, by I am just stressing on, there is no need for doing all the patient for surgery, things like that. And that is, first is hormonal management and non-hormonal is. First we go for the non-hormonal management. That is non-steroidal anti-inflammatory. You usually have heard about the Ponstan, usually we are taking. That usually causes the decrease in the menstrual blood loss. And also the another name is tranexamic acid, that also can be used during for this decreasing the blood loss. And the next thing is a hormonal method. Hormonal method, usually we are using the progesterone to control the bleeding, and also the combined oral contraceptive pills. This doesn't mean it's always used only for the contraception. It can be used for the control of the bleeding also, and regularizing the menstrual cycle. And then come the age group wise, 40 years. What you have to do, if it is a age group is 40 years above and the less 40 years, it is different. The management will become different. Less than 40 years, usually in the reproductive age group, there is usually with the medical management it gets controlled, and no need for going for the surgical management. And the DNC is not a must for everybody that is less than 40. If more than 40 years, and if they are having the intermenstrual bleeding, that intermenstrual bleeding I can explain to you in between, that is the period, not the period prolongation, it is in between if it is spotting. And we have to take a history whether they are having the postcoital bleeding, or if the bleeding is coming in the middle and any infection part, that is abnormal foul smelling discharge in between, and things, this have to be considered. Because above 40 years, And the things we have to exclude is cervical cancer have to be excluded also. The cervical cancer usually, if we are having a pap smear recently, we need not be very afraid of that cervical cancer. And also regarding the above 40 years also, why we are doing the endometrial biopsy, just we have to know about the hyperplasia, that is a condition which is affecting the endometrial lining, and also to exclude the cancer. That doesn't mean the cancer is a very common thing. It is almost less than 5% of cases only present as a endometrial cancer with abnormal uterine bleeding. So need not be scared about that, because why we are not going for the endometrial biopsy straight away. So I can just mention a few things about it, because it's a COVID time. We cannot come to the hospital straight away like that. Don't get worried about it, because I have already told adolescent bleeding, it can be controlled like that with the medical management. You can have a teleconsultation also like that. And also the medical consultation, why it have to be stopped, because if you are having the dizziness, or if you are feeling that you are becoming anemic, or it is a torrential bleeding, you have to come to the hospital. Otherwise it can be managed at home itself. And even in the reproductive age group, if pregnancy related complications is excluded, and you have a recent checkup like that, had a pap smear, and you had a scan or anything like that recently, it will be fine like that. You can just have a medical man. Otherwise, why we have to attend the hospital, we have to have at least an examination to see where there is any uterine structural anomalies. I already have explained to you. It can be a polyp or fibroid. At least on examination, if the scan is not available, or examination, why we are doing a pelvic ultrasound scan, to exclude the structural abnormalities. And also thickness, lining of the uterus. Lining of the uterus thickness, usually during the first half of the cycle, it should be less than 11 mm, and if it is in the second half, that is up to the period coming, if it is more than the thickness, usually people my lining is very thick and things like that. But it is not always thick, because we have to see what is the day of your period. And if your period is towards, that is going to the period time, it can be up to 15 mm, it can be thick. So these are things we are just seeing in the ultrasound scan. And after that, anyway, I will just explain more about the management of any questions. My
Hey,
I'm just
doctor.
welcoming my marketing manager, Mr. Anas, to me. He
Thank
will
you.
ask the common questions what we are just coming through.
But you were trying to explain something, doctor.
Uh,
So if you would like to continue explaining it, what about the last part?
Yeah,
The
I was
investment.
just explaining about the why we are going for the investigation part like that, because ultrasound scan, why it is important. And because in the COVID time they are very difficult to just come over here and have a ultrasound scan. At least if she had a recent any checkup or anything like that, if you have one cycle, if any bleeding like that, with the medical management she can be fine. And also she can have the medical management at least 3 months, and then we can just come to the hospital. Or if it is that is if she is going on for anemia thing is the most important, because people may not be the okay for 5 days, yeah, having bleeding 6 days, no, not like that. If it is continuous torrential bleeding, or she has to come to the emergency like
Of
that,
course, yeah.
to at least do a full blood clot. If it is fine like that, she can continue with the medical management. Otherwise we have to go for the endometrial biopsy. Mostly the endometrial biopsy is indicated in age group more than 40 years. Otherwise, it is fine to have a medical management with the scan. If it's a structural, her uterus is fine, her ovaries are fine, then we can continue with the medical management for at least 3 to 6 months. And
Okay.
then if it is, again, if it is not going on like that, we can consider the other steps of management.
Okay,
Yeah.
but doctor, now if we want to ask, what is the regular type of being having the cycle? It's monthly basis. It comes 7 days, as far we know.
Yes.
But how we consider that there is some issue with our cycle?
Yeah, the
Can
cycle, that is, I already explained to you like
yeah,
that. That is above 38 days. If it is a period not coming, means it is not normal.
after 38
After
days.
38 days. After
Okay.
38, maximum, some people from menarche, some people are getting about 40 days, that will be having a regular cycle. And they will be, that is the maximum thing. Above 40 days, usually we tell that is, it's not a normal period like that.
So they need to come and see a
Come
doctor.
and see whether her ovulation in a correct way or not, and whether she is having any disturbance in the
Sis-
ovulation thing. Because if she is fertility issues or anything like that, we have to just correct it.
Fertility issues.
Yes.
What kind of fertility issues you might get? Like, uh, it might be fibroids. That's why
Yes.
the cycle is not coming correct, right? But what
Usually
else?
with fibroid, the cycle is not disturbed, but usually the heavy bleeding. And also intermenstrual bleeding with the fibroid polyp. It can be with the fibroid polyp, we can get intermenstrual bleeding like that. That is, I told you, in between
In
spotting. And
between.
so we have to consider whether it is a cervical polyp or it's in the uterine polyp like that. Or otherwise, it's a fibroid usually in the that is in the myometrial polyp. Usually we tell intramyometrial polyp like that. That will be causing heavy menstruation. Heavy
Bleeding.
flow with the clots and things like that. So she may have to go for medical management. If it's not feasible, of the fibroid is bigger size, she has to go for surgical management. If it is a polyp, hysteroscopic removal can be done, or otherwise we have to go for laparoscopic myomectomy, or with the age, depending on that's why I am just stressing on the age. If it is about 40 years of family complete, it's a big fibroid, we can consider hysterectomy.
So, doctor, that means that if somebody is in between, they finished their cycle, and in between there was a blood drops, and then it stopped. That means that it's better to review a doctor.
Review the doctor and see whether she is having any problem, because if it is continuing like that, okay, 1 or 2 days it is coming and then stopping, the next cycle she is getting the fine, means it's fine. She can keep a menstrual calendar and see. We can, because we are having the apps and all now. They can just count, okay, this many days I am having the bleeding, and this and also she can consult the doctor like that, and she can talk with the doctor. Okay, this I am having this many days like that. This is the importance of the menstrual calendar. I am just stressing on.
Yes.
So that they can tell, okay, I am having this many, so that the doctor will have an idea also like that. From the history is the most important thing before examination, and also family history. Also we consider, because above 40 years, one lady is telling, okay, she is obese. If she is obese also, the risk is more for endometrial cancer. I told it is less than 5%. But then also, if that 5% also, these are risk factors are, if she is having diabetes, she is having obesity, family history of breast cancer, endometrial cancer, ovarian cancer or colonic cancer, and then these people are on the higher risk of thing.
Higher risk. Okay.
And another thing is a postmenopause. I have to stress regarding it, should not be considered as a normal thing and sit at home like that. Postmenopausal bleeding, we have to consider little emergency thing like that. We have to have a checkup. Because postmenopausal bleeding, we have to see the lining of the uterus, whether it is above 4 millimeter, means no, we have to just, I told you about the millimeter, but it is not, that thickness should be less than 4 millimeter thickness for a postmenopausal lady. And she is coming with the bleeding, the investigation part, we have to just like a one-step procedure like that. We have to go for the ultrasound. If it is thickness, we have to do hysteroscopy or a biopsy to see whether it is abnormal, because the cancer risk is more in the postmenopausal age group.
But it depends on the age group. It's too complicated, by the way, doctor.
That's why I am just telling you about
a lot. This is only in one part we're talking about. Am I correct?
This is a very vast topic like that, because most of the people encounter in our age group like that's from the menarche till that is postmenopausal also, the bleeding problem can happen to anybody.
Yes, got it. Doctor, a question came that if somebody, the cycle is regular and they got late by 10 days or 8 days, they did the test of the pregnancy test and they were not pregnant, negative, and they did not get the period. So what they should do? Should they come to the doctor?
If I know if the previous periods are regularly coming, she can wait for 1 more week and see. Maybe sometimes within 6 weeks, the cycle get little prolonged like that. Maybe this is only one cycle, means they have to see whether she was any contraceptive failure, or if she had any stress factor during her period, this period like that. No, and if it's not coming within stress factor, is also it's having a, because I told you hypothalamic pituitary ovarian axis is the one which is controlling the periods and things like that. So we have to just change of the climate, change of the place and things. So these all can affect the bleeding.
Can affect the bleeding. So there is a stress factor. Okay.
Yeah.
All right. Now, doctor, let's say that the woman is pregnant. She got pregnant, she delivered her babies and everything. What's the frequency of the cycle? It will become regular, or it might start to be disturbed more, usually.
It can be get disturbed because usually the breastfeeding period, the estrogen level, it will be the hormones will be suppressed. If it is a exclusive breastfeeding leading, usually exclusive breastfeeding means we usually tell at 6 months is the exclusive breastfeeding period. And if you are doing like that, even that with that one, no, the lactational amenorrhea period, usually we tell like that. When if you are going for mixed breastfeeding, that is if you are giving the artificial weights, usually the mothers get the periods earlier.
Okay.
And usually the breastfeeding mothers usually get the period little later. And even with this one, no, even the period, if they're not getting also, they can ovulate and get pregnant. Because maybe during going to get the period, if we are not using any proper contraceptive, she has the chance to get pregnant. That is, usually we tell that pregnancy occurred during the lactational amenorrhea period, like that.
Okay.
Ovulation can happen without don't think that if some patients come and tell us, no, I didn't get the period, then how I can get pregnant. It is not like that. There is a period like that. No, the ovulation can happen and the pregnancy can happen like that.
Oh, but there is no cycle,
period,
there is
no
nothing.
cycle happen.
Okay.
Yeah.
So, but doctor, is it possible that somebody might be pregnant and he gets a cycle?
It is not like that. Pregnancy, that is a pregnancy related bleeding.
That's
It's
pregnancy related.
pregnancy related bleeding. It is different from the abnormal uterine bleeding and all. That is why I told you pregnancy should be excluded before going to other investigations.
Yes, but that time that
Yeah.
because you will know.
It can be a threatened
because you
miscarriage.
might,
It can be a miscarriage happening and things like that.
yeah, it's things
Yeah.
like that, because you
Yeah.
might not know that you're pregnant, and then suddenly you might find yourself bleeding. So that will be for the pregnancy.
And another one, I have just this intermenstrual bleeding. Sometimes some people get during the ovulation time, that is not a metal smudge like that, having spotting like that when
Correct.
during the ovulation period. That is not they can see for 1 or 2, 3 cycles like that. That is also considered as a normal thing.
That's a normal
But we
thing.
have to exclude the organic things causes also.
Of course, like come
Yeah.
always and check.
Yeah.
So, doctor, what do you advise all of the patients or all of the visitors always, that when to come and do the checkup? How frequently?
The thing, if you have a fibroid thing like that, because they have detected fibroid like that, okay, 3 centimeter only, and her periods are normal thing, like at least minimum once in 6 months she should have a checkup. And also postmenopausal people also, better to have a once in 6 months routine gynae checkup. And the other thing, adolescent age group, I usually don't tell, because if their periods are coming regular and things
Regular,
like
yeah.
that, and a pre-conception checkup is a good thing, but we are not carrying out routinely in our places and all, pre-conception, marital checkup and all.
Checkup,
It's
yes.
a very good thing like that, because they will be having so many questions and things to be known like that. Only the Google they are going and searching and doing
Which is Google is not the perfect
yeah,
place.
no,
It's
because we
better.
can give them more the answers to the questions and
So we can say 6 months frequently for
yeah,
everyone.
6 months is more than enough.
Okay, and doctor, the fibroids now in the country here, I'm hearing a lot, or it came across that lots of people they started, or women, they started getting the fibroids and facing problems with the pregnancy, because suddenly they discover that they have a fibroid, even that their cycle is normal and everything. So why is that?
No, during the pregnancy, if we are with the pregnancy, if we are detecting a fibroid, usually we are not going to do any surgery or anything like that, unless there is one condition, that is a subserous fibroid like that. That is a condition like that, because it's a complicated thing. If I tell so many things like that, it can get torsion and things like that. That is the only condition. Usually during pregnancy we are doing something. Otherwise, usually with the fibroid, we are not do any surgery during the pregnancy or anything. They usually, what happening, they can go into preterm labor. Yeah, this is the most important thing usually during the pregnancy.
So,
they
but
happen.
what is the cause, doctor, of the fibroids in that
Fibroid,
one?
the exact cause is not known. any reproductive age group ladies can develop a fibroid. Estrogen is the associated cause. Usually after the menstruation, that is a postmenopausal, usually the fibroid regresses. That is means the estrogen is the most important cause that causing the fibroid to enlarge. But it is a definite cause. We cannot tell this is why this happened like that.
So there is nothing specific.
Yeah, no.
Okay. And doctor, the regular age of females that they might have the fibroids, is there any age
No, any
percentage?
reproductive age group person can get a fibroid anytime.
Anytime.
Yeah,
There's
anytime.
nothing
Yeah.
like
Yeah.
no old age will be
No,
getting more.
Old age, usually it will be that smaller, it will grow. Sometimes that is also there. Sometimes that is why I told you 6 months like that, you just at least know 3 centimeter. Some people, the fibroids grow very fast like that. That type of people need surgery. Some people 3 centimeter fibroid, most of the ladies when we check 2 centimeter fibroid, 3 centimeter fibroid, and this depending on the location, the symptoms will be more. Usually, some people having the subserous, usually we'll tell they won't be having any symptoms, and that people we have, why we are checking after 6 months, we have to see whether it is growing in a faster pace. If growing in a faster pace, she needs surgery.
Okay, doctor,
Yeah.
one of the last question is that a lady got a fibroid, it was removed, treated. Would the fibroids come again?
Recurrences. That is why we have to just check. I'm always telling, okay, once in 6 months at least you have a checkup like that. There is recurrences there, because she's having a regular period, her ovulation is coming, her estrogen is coming up. Only after the menopause, usually it regresses.
And there is no treatment completely for that?
No, because usually, medical management is there, but there is only a temporary measure for the fibroid, and there is uterine artery embolization is there. There is another method like that, and the surgical management.
Done. Thank you, doctor, for all the information. It was a lovely session. We finished all the questions.
Yes.
So now we're just saying that thank you for everyone.
Thank you so much for listening to my talk. I know that it's not very, I cannot just elaborate on the topic as such, but it's only a short review of abnormal uterine bleeding and what all things you have to take care, and not to get panic like that, because very difficult to come into the hospital and all for the checkup and things like that. You have to know what is the situation you have to face and what situation you have to come to the hospital directly like that. That is the main thing I have to stress on.
So thank you everyone. With you, Dr. Patricia Edward, consultant obstetrics and gynecology from Medcare Hospital Sharjah. Thanks for listening to us.
Thank you.